Prynawn da, good afternoon. Croeso, welcome to day 2 of the Value in Health Week. I'm Adele Cahill, I'm the Deputy Director for the Welsh Value in Health Centre, and I'm joined today by Dr. Saeed Shadi, who's the Chief Digital Officer within our programme. Saeed has worked in the information technology and data and analytics field for over 30 years. He joined the NHS in 2014 and is really passionate about digital technology and deploying digital services. So today I'm keen to explore with Saeed the critical role that digital plays in value-based healthcare and try and dispel some of the myths around some of the jargon that supports the digital world. So Saeed, welcome.
Thanks, Adele.
Let's Thank you. Let's start by exploring why do we think digital is such an important key enabler to value-based healthcare?
Uh, well, there's a number of perspectives here. If you think about what we're trying to achieve through value-based healthcare, which is the equitable, sustainable, and transparent use of available resources to help um, the outcomes and experiences of the person. One of those available resources, in my view, is digital. And because by leveraging digital, and when I talk about digital, I'm also talking about data as well, because I think the two really go hand in hand. So by leveraging data, I believe we can deliver more personalized, efficient, and effective care, um, and thereby leading to better outcomes and increased value as part of that exercise. And there's a whole range of technologies um, that can support that from a person perspective, but also from a healthcare professional perspective as well.
Yeah, thanks, Said. It's really interesting. I think when you talk to many people and we think about digital and we think about value, sometimes we join those dots. And I want to explore a little bit further. Whilst we talk about better outcomes for people, how do we think the public will react to an increase of digital technology or apps, etc., in as part of their healthcare journey? What do you think some of the challenges might be?
Well, I mean, digital is there in everything we do nowadays, and it has been for some time. Uh, uh, and it supports a whole range of different needs as well. I mean, there's obviously we're all, well, most people are using mobile devices in some shape or form. Uh, Online banking, even using the internet, but be mindful that not everybody has access to the internet as well, which is obviously a challenge that the Welsh Government are trying to address as part of the digital and data strategy. But I think technology, if we can utilise it effectively, then it can be there to support or increase health literacy. So providing awareness to individuals about what information is out there to support their knowledge and understanding of um, health, whole range of health matters. There's the self-management um, of care. And this is through solutions such as proms and supporting their healthier behaviours as well through use of a whole range of digital devices, wearables, other types of apps. But we need to be mindful in terms of challenges that not everybody necessarily has access to digital technologies. For example, the internet. I think the last report I read, 7% of the population of Wales still don't have access to the internet. And even where they do have access to the internet in such rural areas, the service is a bit pro is a bit um, what's the word I'm looking for? Cagey, if that's probably the right word. So yeah, so it's a whole range of different challenges, and then the other challenges around digital literacy as well. So even where they do have devices and technology, are they using it? Do they understand what they're using and how to keep themselves safe when they're using these type of devices as well?
Yeah, that's an interesting one. And I guess, some if we think about some of the areas, the population that we serve, we've got challenges around rurality, geography around this, and access to digital, access to Wi-Fi, those kinds of things. And I guess for us, when we're designing the program around value-based healthcare, is considering all of those aspects and making sure that whatever methodology and systems we design are still equitable for all of the public, isn't
Absolutely.
it? So I guess whilst digital is a huge part, a huge enabler for us in value, thinking about what the other options are as well.
Yeah, and we can't just, and we shouldn't just think about one solution
Mm.
to meet all of our needs. I think we need to be a bit more pragmatic and recognise we need probably a number of solutions to support what we're trying to deliver from a value-based healthcare perspective, especially from an equitable point of view.
Yeah, no, interesting. Thank you, Saeed. So I'm keen, you talked a little bit there in response to the last question around the digital strategy being developed by Welsh Government. So how are the Welsh Value and Health Centre working in collaboration or in parallel with Welsh Government and the newly formed NHS exec in developing a cohesive strategy around digital, particularly to support value-based healthcare?
Well, for me, it's about partnership. Obviously, the Welsh Government have their digital and data strategy, which was launched in the summer of this year. The NHS exec still needs to develop their own digital and data strategy at some point. From a Welsh Fire and Health Centre perspective, we've obviously recently produced our data-driven framework around how we want to collect and process data. And I think it's really seeing how what we're trying to do in the Welsh Fire and Health Centre and the NHS exec aligns to the 6 missions and 3 aims of the digital data strategy of the Welsh Government. So I think there's a number of perspectives here. One is a stock take in terms of saying, okay, of our programs of work, which of those already aligned to um, the Welsh Government digital and data strategy across the various aims and missions, and what's on the horizon, and where are there gaps, and as part of that, then that will help to shape how we prioritize and where the focus needs to be in terms of what we need to be um, looking at going forward.
Yeah, interesting. And I'm guessing I see an advantage of a single strategy that ties in all of the pieces of work that are going on across Wales, particularly when we're talking about communication with patients. It seems to me that there's great strength in joining forces with a national strategic direction around digital.
Yes, and hopefully that also aligns with what health boards and trusts are doing, because um, clearly from a Welsh Fire and Health Centre perspective, we're also reliant on understanding what our key partners' digital and data strategies are as well. So really, we all need to be joined up. The risk and danger otherwise is we'll end up delivering solutions which then mean the data doesn't flow between the different digital ecosystems in a seamless, transparent way, which ultimately is what we want to try and achieve as well.
Yeah, yeah, no, interesting. Well, what I want to explore a little bit further now, and probably a bit deeper, is the work specifically that you're doing within the Welsh Value and Health Centre. So we've talked very briefly around joining forces around strategy. We've talked a little bit around the importance of digital within as a key enabler to value. And we've talked again a little bit around the impact on the general public and some of the considerations that we have to put in place. I'm keen to explore very specifically some of the work that's been done within the Welsh Value and Health Centre. And I know that you've been instrumental in developing what we're calling PSOM, or the PROM Standard Operating Model. And what I'd like to be able to do through this part of the session is dispel some of those myths around the language that we use when we're talking about digital to the lay person. So I'd be really keen to explore with you what exactly is PSOM. How does that help me as not only a member of the public, but somebody working within the NHS? And if I was about embarking on a journey to implement value-based healthcare, what does PSOM mean? And what does it, how do I work with it?
Okay, so let's break this down then to sort of different component parts then. So PSOM, or the PROM Standard Operating Model, um, is really about trying to deliver consistent and standard data between different systems in a seamless manner, ideally in near real time as possible, into the patient health record and the Welsh Clinical Portal. So at the point of collection from the patient through to the end systems where clinicians and well clinicians can utilize that data to have to work with the patient around shared decision making um, and really have more meaningful conversations. And really, PSOM stemmed from when I first came into the Welsh Fire and Health Centre and looked at how we are collecting problems at the moment. So even where we had the same suppliers being used across different organisations, there's a disconnect in terms of how the data is being coded um, and even collected. So even for the same type of questionnaires, prompt questionnaires. So part of what PSOM tries to address is that seamless to deliver that seamless flow. But the advantage of that, and I'll come on to the patient perspective, the benefits, or one of the benefits of this is not just to flow the data from across different systems, but it's also to flow data in between systems as well. So, for example, we all recognise some patients have complex needs and could be going to multiple health boards for treatment and completing PROMs in these different organisations. And one of the challenges is how do you bring all of that data together? So even if a patient's in a patient's home or residence health board may not necessarily see the PROMs being completed in another health board as part of another care pathway treatment. So this whole journey allows all of that data to flow back to the patient's resident health board in their medical record. So the clinician really got the full picture of that person, irrespective of where they've been for treatment. So from an individual perspective, the challenge is getting them to complete questionnaires in the first place, but by providing more seamless channels through which they can complete questionnaires, so electronic forms rather than just paper, through hopefully the NHS Wales app as another channel, albeit it's still going back into the supplier system, but from a patient point of view, they will be none the wiser to what system is behind the scenes. So it's providing opportunities for patients not only complete the prompt, but also see what the prompt is telling them to support their own self-management of care. Because if it's on paper, you fill a questionnaire, send it in, and usually from a person perspective, you don't really see, well, what does that actually mean? And how does it help me? So hopefully by allowing visualizations and other information to be available to the person to see, yes, I can see based on all the questionnaires I've filled in over a period of time, this is what it means in terms of my own health outcome. So it really supports that well, hopefully supports healthier behaviour and the type of conversation they want to have with their consultants or clinician.
Yeah, no, there's so much to unpack there, Said. And one of the things I'm keen to explore as a user or as a head of value-based healthcare in one of the health boards, trying to understand all of the complexities of that and how I get that to work. And um, keen to understand if I don't have that system in place, if I don't comply with the PROM standard operating model, some of the challenges that I might face. And you started to talk there around the access to real-time data, and you've talked about seamless flow of that data. I guess if we delay in jumping on the back of this and becoming compliant with PSOM, what does that actually mean for us as a health board? What are the limits to us?
Well, if you go back to when, again, when I first came into the programme and looked at some of the challenges we were facing, flowing that data in near real time was one of the challenges, but also the amount of behind the scenes manual work that needs to be done to correct the data. So there's whole groups of people having to, I won't say fix the data, but address data quality issues to allow that data to flow on in their own system, never mind into the centre. So there's those issues. But also from the point of view, if you're trying to bring data back to, how do you, if every health board was collecting the same proms for the same patient, it becomes difficult to bring that data into your own organisation where the patient's resident at, without again some form of manual correction or coding. And then the other challenge is around the number of interfaces that need to be built between systems to again to try and get that data to flow. So there's a lot of added complexity and administrative work that needs to be done. And what we try to do through PSOM is simplify that whole journey um, from a organisation perspective. So again, in the future, then if a health board decided to change a supplier, providing the supplier aligned to PSOM, that integration should be seamless. Whereas if they weren't compliant with what we're trying to achieve through PSOM, then there's another set of conversations around how do you deliver that integration with that new supplier, and then how does that data flow into your own repository, and what's the data quality issues and standards you're trying to address, and then how does that data then link up with the other data you've got from another platform if you had a previous platform. So there's a lots of things there that could become a challenge. Whereas what we try and do through PSOM is say, well, if supplies aligned to PSOM, and because we've addressed some of the complexity around what we call metadata, I know that's probably something that needs to be unpacked in itself. So really, it's about how do we link the different elements of that information. So how do we link the patient to their proms, to their pathway, to the organisation, and to feed that data into other systems like the Welsh Care Record Service. Some of those complexities, obviously, we've tried to address through PSOM. So in the future, then, if an organisation decides to change to another supplier, that should be less complicated through this route. The other advantage here is also if there's other systems an organisation is using to collect prompts. So, for example, in ophthalmology, the OpenEye platform, which can be used to collect CAT prompts 5. If there's a desire to flow that data into the organisation, if that system can also align to PSOM, then that flow should be seamless as well. But ultimately, what we're trying to do through PSOM is flow that data into the clinical portal. So by that alignment, we can achieve that. I know there's a lot there to probably unpack, but really that's just some of what we're trying to achieve through PSOM.
Yeah, no, I have to say, I mean, as you know, I'm quite close to some of this with you, and I still quite often struggle to understand not just the jargon, but the interconnections between the flow of the data when we talk about interfacing with different systems. And therefore, for somebody that's not close to this work, I mean, and they just want to collect our patient-reported outcomes or clinical outcomes and want the data to flow into the centre. I mean, they could. I can see how easily we could lose people with this, and that therefore it's been fantastic that the National Welsh Value and Health Centre have been able to work with other national organisations to ease the pressure from the health boards in having to do some of this, but also recognising that there's still an onus on the health boards and trusts to do some work locally to allow this to flow directly from there. So if I was starting in a new job today in a value team, could I assume this is all there and it works for me now, or what would I need to consider locally?
Well, that really depends on the individual organisation and where they are in terms of the maturity of aligning to PSOM. I mean, most organisations are doing elements of PSOM now, but to fully deliver all aspects, there's three areas that need to be tackled in terms of PSOM, which I forgot to mention earlier. One is around data, so how do we code the patient-reported outcome measures? So we've got what we try to do again as part of PSOM is support two different needs, a health board and trust needs, but also the national needs. So the premise of PSOM is designed to support both of those needs. So from a national need, we've defined, I think there's 68 national PROMs, so gone through clinical validation and use. So there's coding already available around what we call data standard change notices, or DSCNs. So there's 68 of those in place. There will be 46 pathway guides to support the collection of those 68 PROMs. And then from a technical point of view, how you package and process all of that data should be in place for the 68 PROMs. So that's the bit that we're almost there. So really, PSOM's about three bits. One is data collection. Second is around what we call pathway guides or processes. So at what points do we want to collect the PROMs on a particular pathway? So whether it's on a chronic condition pathway, where there may be a referral pre-op intervention, then post-op, it's at what points you want to collect the PROMs. And we've defined the minimum collection points, which doesn't stop organisations from having additional collection points. But there's also information around licenses and the scoring methodology as part of that. And then the third element is the technical side. So you may have the data standards and process standards, but it's important then to ensure we're being consistent in terms of how we package and then communicate that data across different digital ecosystems. And the approach we've taken from a technical point of view is to align with the National Data Resources Interoperability Standards, which is based on something known as HL7 FIRE, which is a recognised healthcare interoperability standard. So it's really just saying this is how you package the data and this is how you flow that data between two digital systems. And that's so from a national perspective, that toolkit will be there if it's not there already. It's definitely imminent. As I've mentioned, the second part of what we've tried to do is support local needs. So this is where if individual organisations have PROMs that they want to collect within a particular clinical area that's not gone through or agreed from a national perspective, again, they can use the system to collect those prompts, but that's a local decision then in terms of how they ensuring that they follow the same data standards in terms of how they code it, but it's down to them to put that coding in the system to flow that data then between the different from the prompts provider into their respective organisation. But we try to simplify a lot of that by trying to give the organisations the digital tools to deliver the technical part of it, so they're not having to manually build that themselves.
Yeah, no, it sounds fantastic. The fact that you've been able to take a lot of these manual activities and digitize them so that it becomes even a bit more seamless before we even think about what needs to happen and from a digital perspective. And you know, I still find this subject matter a challenge, even though we talk about it very regularly. And you have produced piece on, and I'm right in saying, Saeed, that there is a short video available for people, which we can add a link into this sessions, which explains it again in a
Yes.
very simple manner, isn't there?
Yeah, so it talks about the principles of what we're trying to achieve through PSOM and the benefits of what it can deliver. There's obviously other sessions with the organisations around what we call the document pack, which really gives them all the information they need to take them on this journey now around implementing all of this.
Mm.
But
Yeah.
I think one key point, which I mean, ultimately, then this is about delivering not only the data in near real time and the consistency, but there's other benefits from a insight and analytical point of view we can
Mm.
achieve then once we've got that consistent flowing between the systems as well.
Yeah, and I guess, that's the fundamental piece of all of this, isn't it? That unless we get the data and the prompts in particular to flow in the way that you've just described, we aren't able to do anything with the data in terms of benchmarking or doing any further analysis with it, because it just would be so difficult given the manual intervention that would be needed. So, yeah, it's really fundamental, isn't it?
Yeah, and even when we talk about trying to analyze data at the population level, again, that becomes difficult unless you've got some consistency to aggregate and compare like for like data, and even analyzing data at a patient cohort level. Again, that's difficult unless you've got some consistency in that data. But I think the other key area for me personally is, and we're all talking about artificial intelligence and
Mm.
machine learning, and I'm not sure if you're going to come on to this, but I think for me, there's a advantage of trying to, by getting the consistent data, is how we can then use and leverage these type of technologies to get greater insights to questions that we haven't even thought about asking.
Mm.
And that's, I think, it's only becomes easier if we've got that consistency in the data in the first place.
Yeah, no, I will. I'd like to come on to AI later, or in particular, what do we see as being next steps? Once we've been able to finalise this particular piece of work around PSOM and its availability to health boards and trusts, then what's next for us? What's our considerations? But I just want to go back a little bit, because I still come back to the point that value-based healthcare is all about what matters to that person. And we've talked very briefly at the very start around making sure that we provide an equity to people, and digital, or the way that we digitize this, is only going to affect a proportion of our population, and that there's still going to be a significant number left, I'm guessing. And I'm keen to explore with you, and whilst this is our a core subject for both of us, I am keen to explore through this how we think we can make sure through the health and care system that we are including everybody. And I'm guessing, if I were to think out loud, that this would be more around healthcare professionals supporting people to do this digitally, rather than expecting everybody to change the way that they currently communicate with the healthcare services. So do you have a view around that side, how you think we'll get maximum benefit from the public through the use of digital? You know, are we going to have to provide more healthcare support, or how do you think we could do that? Is AI part of that?
Well, I think there's a number of things. I think part of this is partnerships with. I think it's broader than just health and care. I think it's something we need to work with Welsh Government on as well, because it's about how do you make sure um, there's equitable access to technologies for the population, and whether it's, I mean, even if it's not a case of making sure everybody's got access to internet at home, it's how do we buy channels where they can access these type of services, and whether it's through libraries or other um, hubs that people can go to access technology. I think it's a sort of broader consideration um, from a health perspective. We need to be mindful that there is a proportion of the population that may not seamlessly have access to these type of technologies. So when we're talking about um, telehealth and virtual consultations, again, we need to be mindful that can only work for a certain sector of the population. But even where that technology is available, again, we need to be mindful to the digital literacy of the individuals as to whether um, they're okay to use these technologies, and there's certain population groups, again, unless we design it accordingly, may not be able to use the technology from a capability point of view or other perspective. So there's a lot of opportunities around, even from what we're trying to do in the Welsh Fire and Health Centre around patient-reported outcome measures. Yes, we can digitise the form and allow patients to complete it online. But I think there's opportunities to explore other solutions such as voice prompts and chatbots as another channel for those to try again trying to um, include as much of the population as possible. So there's those type of technologies. I think AI will have a role to play in some shape or form. It already does. Even if we like it or not, or realize it is or not. But I do think there's an opportunity to use these type of technologies as well.
Yeah, no, I'm laughing to myself. I'm just getting used to the terminology around PSOM and DSCNs, and now I'm thinking about chatbox and AI, and I think I'm gonna, I think I have to try and keep up in this space. So, talk us through a little bit side. I mean, this is a personal view from you around, what's next? Do you think? What else do you think could support, through digital and tech as key enablers around the value-based healthcare or health and care journey? I mean, the more and more we talk about this, it is about health and care,
Yeah.
thinking about how we link in with social care, local authorities. So what thoughts have you got around the future of digital?
Well, I think one area I think we still to explore, and and it's probably still early days yet, is around sort of smart devices, wearable devices, and I think that probably has a role to play as well, um, and how we can try and leverage those type of technologies to really capture vital information and feed that through the system. I think that's one strand. As you say, it's about health and social care. There's loads of challenges in social care from a technology and digital perspective. I mean, it's interesting. One of my friends, who's an A&E consultant in London, was saying the number of patients he sees in A&E that have suffered hip fractures because they've fallen in their care home or at home. And he was asking me, is there technology that um, that works with CCTV cameras that keeps the individual details of the person sort of private in terms of only providing an outline image, but actually shows what actually happened to that person. So again, I did have a think about it, and I thought, well, that's actually not a bad idea in terms of seeing how we can, again, utilize technologies we've got now, but try and use AI and other sort of technologies or solutions to capture key information or recognize when a person's fallen, for example, and alert somebody,
Yeah,
rather than waiting for somebody to try and press their um, um, smart device that they may have on them.
yeah.
So there's a whole range of things I think we could still look at to improve that person's experience and outcomes that matter to them.
Yeah, no, absolutely. I mean, it's fascinating, isn't it, what the art of the possible could be, and how we would use technology. Particularly keen to watch the space around wearables and so on. We see just in terms of healthy lifestyle, the number of
Mm,
devices that have been brought onto the market already, and I think more and more people are switching on to that. So I'm really keen myself to watch that space and think about how that can help us, particularly when you talked in the beginning around, self-care,
mm,
self-management, and actually how the use of digital and tech can help us as individuals to prevent ourselves from getting, any nasty chronic diseases in the future. And I think that's the important piece, is when we're looking at these health and care pathways in order to evidence value. I mean, concentrating up front on how we can use tech and digital around prevention, I think is really important, isn't it?
yeah, I mean, I'm starting to see more of that. It's like the adverts that you see on TV now from about Freestyle Libre to support um, diabetes, and rather than having to take a prick and sort of see your glucose level, you've got the app now that can sort of
Yeah.
assess more or less in real time without you having to do any of that. So again, it's a convenience factor and that lifestyle choice as well to try and um, improve that person's experience really.
Yeah, no, fantastic. Well, look, Saeed, I'm going to ask you for a couple of takeaways in a second, but I think if I just summarize some of our discussion, and particularly for those listening in today, um, I think what we've witnessed individually and collectively as a program is that integrating digital and tech into the value-based healthcare space has been challenging. We have um, cut our teeth a number of times in this space. However, the result of having to do that, the hard work up front, will pay off hugely in terms of our ability to flow data seamlessly throughout the systems across NHS Wales. And that, if you are thinking about doing this in Wales, well, great, we've already got a national team that's helped in that space. But if you're listening in from outside of Wales today, then we would urge you to get in touch with Saeed and the team to talk through in detail how they've done some of this. Um, I think it's interesting when we talk about how we're going to deal with uh, the fast pace really of digital and tech as it's entering our world, and we do see this, and how we make sure that we don't leave individuals behind, and we make sure that what we offer to patients through health and social care is equitable to everybody, and we're going to have to keep an eye on that as we go through our program. And then you talk more latterly around the exciting stuff to follow potentially, and how we're going to follow and work with Welsh Government on their strategy around artificial intelligence and robotics, and how again that can help us with collecting and churning our data and looking at other aspects. So I wanted to say thank you for that, Saeed. I could probably talk about this for a long time because every time you mention one area, it's an area of discovery that I'd like to know more about. So thanks for that. But if you were leaving our listeners today with any key takeaways from your journey so far, what might they be?
Uh, well, I suppose there's a number of things that we need to be thinking about. One is some of these technologies aren't, when we talk about digital and technologies, they're not necessarily new technologies. It's just that some of these have been around for a long time. AI, for example, I know everybody's talking about it now, but AI in some shape or form has been around for the last 15, 20 years. So, in fact, even longer than that. I think it's just now, with the way the pace technology in terms of infrastructure and hardware has progressed, that the use case for these type of technologies has increased. So I think one of my takeaway messages is not to be afraid in terms of using these technologies. Notwithstanding the fact we've still got some challenges to address around keeping the data secure, confidential, and addressing cybersecurity, which is a challenge no matter what the digital offering is. But I think embrace the technology if there's an opportunity to embrace it. And secondly, is around data. I think, again, there's opportunities here to explore the unknown. I mean, when I came into the digital and data space, as you say, 30 years ago, trying to analyze data was a challenge from a whole range of perspective. Now we've got solutions in place around cloud and other technologies to analyze vast amount of data, and even utilizing AI on top of that to try and really explore population level health information and complex information. And I think from a data perspective, it's exploring and utilizing these type of technologies to really to explore the unknown really as well.
Yeah, no, I mean it is. It's a fascinating world, and you know, if I think back across my career, how things have progressed as you've just described, it's just fascinating, really. So, we look forward. Oh, sorry, I don't know what happened there. We look forward to the next 20, 30 years, and let's see what happens. But so thank you once again. For those of you listening in, we will pop the link in the chat bar around the piece on video and some of the other documents that Saeed mentioned in the chat. I know that we've probably got about 15 minutes left of the session. So what I'd like you to do now, encourage you to put some questions in. And then what Saeed and I will do, we'll provide some responses back to that session, which you'll be able to access directly online. So thank you all very much for your time, and thank you very much, Saeed. Thank you. Bye-bye.
Thank you.
Stop recording. Stop.